Ashok Kumar. Yeah. He'll be presenting half fluence photodynamic therapy in peripapillary circumscribed choroidal hemangiomas. Your time is 6 minutes, and discussion time is 2 minutes. Okay.
A very good afternoon and warm regards, everyone. I'll be presenting on.
And if we have to, somebody has to click the timer.
Very good afternoon and warm regards, everyone. I'll be presenting on half fluence photodynamic therapy for peripapillary circumscribed choroidal hemangiomas. Choroidal hemangiomas are very uncommon benign vascular tumor of the choroid. They can be either diffuse or circumscribed. The circumscribed choroidal hemangiomas or CCH are typically unilateral. They are round and well circumscribed, orange reddish in color, and mainly found in the posterior pole of the fundus. That's why they become a little more symptomatic as compared to the diffuse one. On FFA, they typically show a very bright hyperfluorescence with rapid early filling of the vessels, and OCT shows a typical dome-shaped contour of the retina with absence of choriocapillaris compression. These circumscribed choroidal hemangiomas usually present with a very significant visual impairment because of presence of macular edema as well as serous retinal detachment. And if chronicity per se persists, then they lead to photoreceptor loss, which can be avoided if treated early. The different treatment options which are available with us include laser photocoagulations, cryotherapy, proton oblique external beam radiotherapy. TTT has also been tried, but off late photodynamic therapy has become treatment of choice for these patients. But all these treatment options have potential complications in form of choroidal atrophy, optic nerve damage, which is more common in circumscribed peripapillary hemangiomas, where you need to treat this patient closer to the optic nerve, and obviously photoreceptor loss. So targeting a peripapillary hemangioma with the full fluence or bolus PDT can lead to inadvertent damage to the vascular supply of optic nerve head and further optic atrophy. On the other hand, if we use half fluence PDT, which has been tried in other choroidal pathologies like IPCP as well as CSCR, has shown that reduced complication as well as increased or comparable efficacy in these patients, as reported by Elkin and Bong et al. In their studies. So when we target a abnormal vascular tissue within choroid, even with a low or a half fluence setting, it becomes a logical and safe option. So with this background in mind, we planned this study to evaluate the safety and efficacy of half fluence photodynamic therapy for treatment of this symptomatic circumscribed choroidal hemangiomas. So it was basically a prospective interventional study carried out at Tertiary Care Referral Hospital of Armed Forces in North India. All patients who had symptomatic peripapillary circumscribed hemangiomas more than 18 years of age and presented between June 2017 to May 2020 were included in this study group, and all patients who had a previous history of treatment in form of laser, anti-VEGF injections or PDT for hemangioma or any other concurrent retinal disease was excluded. All patients underwent a comprehensive ocular examination in form of best-corrected visual acuity, fundus photos, FFA oblique ICG. SDOCT was done for measuring the central macular thickness and RNFL thickness. USG B-scan was done to diagnose, to confirm the diagnosis, and visual evoked potential was done at the baseline as well as repeated at 6 months post-treatment. Informed consent was obtained from all the patients. So all these patients underwent half fluence PDT under the standard setting, except that laser power of 20 millijoule per centimeter square was used in place of 50 millijoule, which we use in a standard setting. Laser spots varied according to lesion size, and a safety margin of almost 200 micrometer of treatment was kept from the optic nerve head. Retreatment was given in only those patients where if fluid persisted at 12 weeks post first treatment. And all these tests were repeated at baseline, 4 weeks, 12 weeks, and 24 weeks. Statistic analysis were carried out by using ANOVA as well as pair t-tests. During the study period, we had 13 patients which were treated with half fluence PDT. Of them, only 11 completed the required follow-up. Average age was almost around 54 plus minus 9 years. There was a male preponderance. Out of the 11 patients, 7 were males, and all patients were symptomatic with diminution of vision and had macular serous detachments. So once we treated them, we had a structural as well as functional improvement in 9 patients. That was almost 81% after one sitting of PDT with half fluence, and all patients, or 100% patient, had a functional as well as structural improvement after one additional sitting in 2 patients. And best corrected visual acuity improved significantly from baseline at 4 weeks, at 12 weeks, as well as 24 weeks in these patients. 2 patients who had a minimal reduction in subretinal fluid were repeated with a single session of half fluence PDT at 12 weeks, and central macular thickness also reduced significantly from the baseline at 4 weeks, 12 weeks, as well as 24 weeks. No adverse effects or complication of treatments were noted. BAP measurements didn't show any increase in P100 latency or decrease in amplitude. No significant change in RNFL thickness was seen pre and post treatment. So this is the image of one of our patient having a large peripapillary circumscribed choroidal hemangioma, which was confirmed on a ultrasound B scan, had a large intraretinal as well as subretinal presence of fluid, and RNFL thickness was normal before treatment. And this is what we could achieve at 24 weeks. We can see this shrunken choroidal hemangioma and total disappearance of intraretinal as well as subretinal fluid in this patient, and RNFL thickness was same. This is a demographic and clinical profile showing 2 patients required a half fluence PDT, which was repeated at 12 weeks. So PDT is a treatment of choice for choroidal hemangioma, as it steadily targets abnormal choroidal vessel without affecting overlying neurosensory retina. Is indicated in symptomatic patients which have macular edema or subretinal fluid. Various protocols has been used, and almost all protocols have been effective. But these standard protocols have a lot of procedure-related complication like damage to optic disc vasculature, which is more common with the peripapillary circumscribed choroidal hemangiomas, choroidal atrophy, treatment failure, perifocal hemorrhage, as well as choroidal effusion. So our study was the first attempt at evaluating safety and efficacy of half fluence PDT, and visual improvement in our study was comparable with what was reported by Robertson et al. Using a bolus or full dose PDT. Only 2 patients required a retreatment. And one of the positive factors of our study was that a new parameter in form of RNFL thickness was used for the first time to establish the safety in these patients. Our study had certain limitations, small number of patients, no control group, and even the follow-up was smaller for only 6 months, because up to 35% recurrences have been reported on a long-term follow-up. But the strength of our study was the new variable of RNFL thickness, which was used to validate the efficacy. So to conclude, half fluence PDT can be a safe and effective treatment for symptomatic peripapillary hemangiomas. Both anatomical as well as structural improvement has been noted with no observable complication, but we recommend that large prospective comparative studies would be required for a more significant evidence to validate this protocol. Thank you.
Study was done only in a peripapillary.
So 13 with peripapillary choroidal hemangiomas only. Sir.
Okay, only.
Out of them, only 11 completed the 6 months follow-up. 2 were lost to follow-ups. So that's why only 11.
And how many repeat?
So 2 repeat. We required only
twice.
Repeat PDT in 2 patients.
Okay, only.
You think the parameters should have been changed for the repeat PDT?
Sir, the basic cause, what we felt of the retreatment was because these hemangiomas were large in size, more than 5,000 micrometer. So we could have gone with the addition of anti-VEGF or something like that along with the PDT. That would have been a...
There was a catch in this question. I think you should have titrated it with the amount of fluid which was there. It would have interfered with the PDT treatment, even if it was half fluence. In the sense that higher the fluid, larger the fluid, those patients who had more fluid must have needed the
little higher parts, even little higher fluence.
Or repeat.
Repeats.
How you have spared 200 microns from the optic nerve?
So it was just...
No,
we tried not to go as much closer to the optic nerve head so that at least optic disc vasculature and all those things.
I was just wondering that you said that RNFL was preserved in half fluence PDT. Do you have any idea how was it with full dose therapy?
So we don't have...
Generally, that won't affect the RNFL as well, because it's the choroid which gets affected by the laser that you do, the PDT.
I thought you should have brought out in literature some report of damage to the optic nerve head and reduction in the RNFL thickness with full fluence
So we searched,
PDT. The reason is,
sir,
it doesn't seem logical that there would be damage to any of these
Sir.
structures. I appreciate you are having done this, good thing,
sir.
but for the purpose of,
So we did a comprehensive search, but we couldn't find anything.
perhaps next
which
time you can
actually-
tell us what happened to those patients after 6 months. But it's a good
Good,
initiative.
good,
Thank you.
but it's
thank you.
appreciable that you have got so many peripapillary.
Because the study
choroidal
was carried out at only
center.
referral hospital of armed forces, so that's why we had a
Yeah.
referral from
Yes.
all
All
over the
India-
country.
all
That's why
Yeah.
we could get so many patients.
Good
Otherwise
study.
It's difficult to get so many patients.
Okay, thank you very much.
Thank you.
Thank you.